Hello everyone, today we're gonna talk about another real case at Dr. Jacobman's office in Beverly Hills. So our patient today is a lady, 50 years old, very healthy, beautiful, happy, until they did a root canal a few years ago, and she started getting in a lot of anxiety for different things in life happens, and start grinding the teeth. Remember, we talked in one of the episodes was grinding, and they never offered, or she didn't want to have a niger to protect the teeth. Sometimes what happened is that we ended up moving the crown. Some other times, like in this case that we're gonna see here, the crown that was done in this patient is done in a way that is like a shoulder. So this becomes a trap. When you see a crown in your case that is not smooth like your real enamel, you need to ask your dentist to try to modify, or you need to go and get a second opinion, because the food gets trapped in these areas very easy. So the patient developed this infection. And in endodontics, we usually say, well, it can be a cyst caused by a trauma, or it can be a cyst caused by the bacteria that we have in the mouth. The bottom line is like an abscess, is like a pimple, is like you're gonna have to drain, because when the infection continue and you don't control the infection, remember, you can get a septic shock, bacteria in your teeth. It's very well published in scientific research that goes to your body. So when you see an abscess on the x-ray like that, this is the image that you see, like this tooth. This is when the tooth is infected but doesn't have an infection like this. This one has an infection, and when you have this type of infections, this bacteria is extremely nasty, has to be drained, and has to be taken out of your body. So the patient said, doctor, what are my options? I don't want to lose the tooth. I explained to the patient, one of your options is to have the tooth extracted. It's not the first option I offer the patient, but what happens when we have the tooth extracted? If you have your tooth extracted, now you're gonna be committed to have a bridge, because implants are $7 from $2,000 to $8,000 per implant. And the way the implants now are made, they have a good amount of years of prognosis. But root canals well done can last forever too. If you have a good crown, if you brush and floss correctly, everything lasts if you take care of the teeth. But when you have a bridge like this, then you're gonna create some mobility, because this tooth that is extremely weak, the premolar, is not as good as the molar. This has only one root, and it's very hard for this tooth to take care of the load of the support and the strength that the mastication forces are producing. Now, I will highly recommend at then not do a bridge, but do an implant. And an implant is this kind of a screw. They're very well, they're excellent materials. They have to go into your bone. If you don't have the bone, like in the case of the patient, because she's losing it, then they have to place bone that we use to place in this area. And then after the 4 months, then you come back to the dental chair, and they're gonna place this abutment when the implant is inside, and this is called abutment. And on top of the abutment, they're gonna place your crown. What is the advantage to have an implant? Well, it's excellent because you will not have to touch these teeth. These teeth will never be touched. The teeth and the sides, like in my patient that has 2 crowns, she will not need to have new crowns because they will just work in this tooth. So that's one option. But my first option to the patient is, let's do the root canal, because she doesn't want to even think about losing the tooth. After doing all the endodontic evaluation, I decided to drain. In the old times, we used to do incision, a huge incision. Now, we're able to go through the infection with one of our instruments, and start draining. Then I have a surgical material that I'm gonna use inside. It's like when you go and have blood test and they're gonna use the same cannula. That is gonna be used for that. We're gonna use it to suction all the blood that is inside the infection. And with our suction and the small suction with the cannula, then it's like a catheter, no cannula. It's like a catheter, very small, but it's very efficient to take all the infection out, so the pus come out. I love when I see all the green coming out and then the blood, because that means that we're gonna create the healing. Once we have that done, we are gonna do the root canal again. And in February, we finish the root canal. But guess what happened? The patient come back, because I see my patients every 3 months when they are trying to heal, every 6 months. And then I saw in October, it was already 10 months. The fistula came back, the little, pimple here came back. We have to drain again, and I said, you are gonna need surgery, and we need to remove this part of the root. And then we remove all the bacteria that we couldn't remove, and the body didn't heal. Then we see the patient later, and this is how we're gonna find out that now she has the bone came back, and the patient is very happily ever after, right? Because after having an infection like this, after this, the patient came back, and now she's extremely healthy. She's been with a provisional crown, and now she's coming to have a crown. We decided to wait a couple of, like a year and a half, so we know that infection has healed. The crown is gonna have a new crown because she's been wearing a provisional crown that Dr. Vijay placed on her mouth. So now you know. And what is the best of all this? What's the mission of this channel is to avoid that you have dental problems. How are you gonna do it? Brush and floss every day. Avoid to have any cavities like this size. If you're grinding your teeth, wear an eye guard, so you will avoid that the tooth can get divided and get fractured like this because you're grinding and clenching. Don't chew eyes. There's many things that you're gonna learn in this channel. You can avoid going to the dental chair every month, but you go every year. Check your teeth, have your cleaning. Don't forget to subscribe. We're gonna have many more tips in Instagram and TikTok too. Thank you.